Je suis très heureuse de vous présenter les prochaines et dernières, mais loin d'être les last but not least, présentatrices. Le sujet aujourd'hui pour le dernier panel numéro 5, c'est vulnérabilité périnatale. Et premièrement, pardon, parce que je fais le switch entre l'anglais et le français. Ça va être à Tanya Pierre-Sindor de l'Université McGill. Tanya Pierre-Sindor est diplômée en psychologie de l'Université McGill, spécialisée en études du genre, de la sexualité, du féminisme et de la justice sociale. Elle se passionne pour l'impact de l'intersectionnalité sur différentes questions d'actualité, ainsi que pour les conversations sur le positionnement et les différences de pouvoir. Elle explore ses champs d'intérêt dans le cadre de ses travaux universitaires et cherche à intégrer ses connaissances à ses projets dans le domaine de psychologie. Et après Tanya, ça va être Nahantara Lafleur. Elle est agent de recherche sur la supervision de le médecin épidémiologiste Nathalie Auger. Notre équipe se spécialise dans la recherche sur les disparités linguistiques de la population en matière de santé maternelle et infantile. Alors je parle au nom de l'équipe, travaux antérieurs comprennent des études sur la minorité linguistique et le risque de problèmes à la naissance, tels que la mortalité et les prématurités au Québec. Nous étudions également d'autres sujets tels que la santé mentale, les anomalies congénitales, la mortalité et l'impact de la pandémie de COVID-19 sur les résultats de la grossesse. En collaboration avec des partenaires provinciaux, nous contribuons à la surveillance et au suivi de la santé maternelle et infantile au Québec. Alors, on va commencer avec Tanya. Alors, s'il vous plaît, gardez ça proche de votre bouche.
OK. Bonjour, moi je vais présenter en anglais. Je parle français, donc s'il y a un terme que je dois traduire, je vais essayer de mon mieux. Okay, so over the course of 7 months, I was able to analyze a large amount of data, which permitted me to develop a mixed method qualitative study on the perinatal experience of Black birthing people in Quebec. This project was done in collaboration with Rachel Wilcoxson, a communication graduate who currently works at Concordia University in Montreal as well. So throughout my academic journey, I was able to develop a deep interest in the psychosomatic effects of marginalization of people of color and the effects of protective factors against said marginalization. With the growing body of literature addressing Black maternal mortality and morbidity in countries such as the UK and the US, I decided to determine if any sort of inequities, like the ones seen in those countries, were also present in Quebec. And if so, what factors contributed to this phenomenon? Through preliminary research, it became evident that Canada's maternal mortality and morbidity rates are way lower than our southern neighbors, which is great. But I still dug a little deeper, and I found that in Canada in general, the data collected on maternal mortality and the perinatal experience in general is quite colorblind. They take a colorblind perspective to it, where they don't take in consideration race or ethnicity. So that's where I was like, I need to do a little more digging. Okay. So for my methodology, it was a qualitative research that consists of literature review with of over 25 articles addressing multiple aspects of the perinatal experience of Black birthing people in North America and the effects of institutional and interpersonal discrimination. The second part of my project involves a 35-minute interview conducted with a medical student who also works as a doula in Montreal. So for my literature review, I start with American literature because it's so abundant. It's so abundant because they deem Black maternal morbidity and mortality as an ongoing crisis. According to reports, Black Americans are 3 to 4 times more likely to experience maternal mortality compared to their white counterparts. In America, factors such as cardiovascular issues, discriminatory social context, and social cultural determinants play a crucial role in the exacerbation of negative perinatal outcomes. The detailed information from American literature provided kind of makes the gaps in Canadian literature even more salient, as obviously both countries don't rely on the same institutions or cultural condition, but they're quite similar in many aspects and trends. Sorry. Okay. For Canadian literature, as I described before, it's quite scarce. There's still some researchers who delved into the issues of adverse birth outcomes in Black populations. For example, I think, yeah, okay, in your research, sorry. It was found that in Quebec, Haitian women were 4 times more likely to experience preterm birth, which is when the child is born 27 weeks or prior, and 2 times more likely to experience very preterm birth, which is when the child comes out about to the 28th to the 31st week. Compared to their white counterparts. Another study done in Toronto investigated the more subjective experience of people of color throughout the healthcare system, and common themes of dehumanization, unequal access to health services, and discriminations were found. Still, because of the colorblind approach, it's quite hard to get a comprehensive and objective understanding of the perinatal experience as a whole. So, now for the factors that influence maternal health experience. The first factor is language in which care is delivered. This factor extends to obviously not only to Black birthing people, because linguistic minority communities such as Anglophones in Quebec include people of all races. But still, it has been demonstrated that patients from culturally and linguistically diverse backgrounds experience more language barriers, which contributes to poorer quality of care as well as patient safety. Language concordance between patient and provider is essential for effective communication, as it ensures accurate assessment, examination, diagnosis, and prescribed treatment. While hospitals may be able to provide care in other languages or have access to translators, the ease of communication may not be as fluid and may lead to many important misunderstandings of access to information, understanding medical terminology, or even consent. So the solution that many of these birthing people find is to travel longer distances to find hospitals that are adequate for their linguistic needs. This was especially true for migrant women whose first or second language was English in Quebec. Previous literature tells us that, in general, longer travel time from the patient's homes to their birth hospital were linked to higher rates of preterm or perinatal mortality. Ogenal studied the effects of birthing people in Montreal and found that delivery at a further English hospital was strongly associated with stillbirth and preterm birth, while delivery at a French hospital was more linked with stillbirth. It was also found that Anglophones in the province with moderate to high material deprivation were up to 1.5 times more likely to experience stillbirth than their affluent counterparts. This further proves the need for the necessity of better access to prenatal care in people's language, as it could potentially prevent from adverse perinatal outcomes amongst disadvantaged populations. The next factor is healthcare accessibility and economic stability. In a country where healthcare is free, one would not think that healthcare accessibility would be such an important factor, but people who have lower incomes often do not have access to the best adequate or the most adequate healthcare service that they need. For example, we see gaps in healthcare accessibility, through pharmaceutical needs, physical therapy, at-home care, or any type of other tertiary care. Poor living conditions experienced as a result of lower income also often leads to unhealthy life habits, which in turn discourages people from attempting to access the best quality healthcare that they can, and as well as maintaining any good health habit on their own volition. The next factor is control over your healthcare professional. So an important aspect is control. Control allows especially first-time mothers to to reduce their anxieties. And it's been proven that when given the choice, Black mothers often choose physicians that look like them, that resemble them, that respect their religious and cultural values. And this is especially important as culturally safe practices are often forgotten within the Quebec's medical institutions. Adopting culturally safe practices can not only facilitate treatment during birth, but also postpartum care. It's also found that patient and physician concordance for Black pregnant patients reduces common comorbidities such as eclampsia and preeclampsia. Sorry, switch a little fast, but these types of findings are very important because there's a increasing lack of diversity within medical institutions in Quebec. So the next factor is social support and resources. Giving pregnant people the opportunity to follow prenatal courses, as well as other various health education programs and resources, has proven to help reduce anxieties they may feel and provide them with tools that lead to more positive habits and routines so that they feel less reliant upon Quebec's already fragile healthcare system. Recent studies have addressed the ways in which common stressors affecting Black women are unique due to their emotional or traumatic nature and the fact that these women face them at such an early age. The intersection of gender and race-based stress plays an important role in the exacerbation of maternal mortality and morbidity. And the protective effects of a healthy support system help mitigate the effects of that stress, especially for high-risk pregnancies involving gestational hypertension, which is often a risk factor seen in Black birthing people. So for the next part of the project, I interviewed a medical student who also practices as a doula in Montreal. I found that their background was perfectly suited for this project, as their service as a doula is mostly geared towards Black birthing people, and their experience as a Black medical student is quite important as well. This interview was not only a great opportunity to gain knowledge on the way Quebec trains its medical prospects, but also help us understand the advantages of having a doula during the perinatal journey as a Black birthing person. So when asked about the ways medical school addresses medical racism, our informant confirmed that it was often done through white voices and with a lot of homogeneous remarks about diverse groups of ethnic cultures. This further stresses the importance of including Black physicians and educators in the medical field. Still, she praised the efforts of her academic institution as they do try to diversify the medical field by taking initiatives that seeks to increase admission rates of Black students. However, she reiterates the need for constant and continued efforts as she has yet to see the results of these types of programs. In terms of the resources provided to Black birthing parents, the interviewer recognized that the service that they offer as a doula can be quite inaccessible, as it also falls into a healthcare service that is not covered by the government. But still, they explain that through the historical silencing of Black voices in the medical field, many Black patients have developed a certain type of distrust towards healthcare workers. And so having the option to have someone who looks like them, like a doula, who could advocate for them is extremely important, especially when there is a lack of social support network. An important aspect that we addressed in this interview was the lack of empathy often demonstrated by physicians. To them, it may be like a normal day in the office, but for patients, it's an important step towards their journey to parenthood. Having a doula throughout their journey helps alleviate the stress that patients may feel as a result of this lack of empathy. Lastly, the limitations that I encountered for this project was a lot. At first, when I started this research, I wanted to collect primary data from Black birthing people in Quebec. But this research was part of a bigger project started by the Black Resource Center in Montreal. And I unfortunately joined the initiative a little bit late. And so as time advanced, I realized that I wasn't gonna have enough participants. Actually, I had 0. But I decided to switch the aim of my project and look and focus on secondary data and dive into the factors that lead to negative perinatal experiences in Black communities. This setback was pretty harsh, but it did not discourage me from continuing the study. And I do want to further dive into themes of Black perinatal experience, which with more time and maybe more incentives, because I realized also that this is quite a sensitive topic to talk about and not everyone is comfortable with it. And a little incentive, monetary incentive sometimes helps a little. So in conclusion, our study presents the ways in which having access to a Black physician, a healthy support system, a physician who speaks your native language, access to complementary medical resources, social determinants of health, and overall culturally safe practices are all factors that are important in the perinatal experience of Black birthing people in Quebec. The interview conducted with our informant solidified the sense that Quebec not only lacks diversified physicians and scholars, but also accessible resources and a focus on empathetic care. While this study dives deeper into the current literature available on the Black perinatal experience, I do believe that tackling the realities of Black non-binary and transgender maternal experience in Quebec is also crucial. Black women's femininity has always transgressed the boundaries of white supremacist gender binaries. Black women are seen as an oxymoron, as womanhood is nested within whiteness. And with the historical understanding of Black womanhood, we can realize the importance of exploring present-day Black non-binary and transgender maternal experiences in order to better suit maternal outcomes for everyone. Lastly, I believe that investigating the perinatal experience of Indigenous people in the province could also be informative and very rich. Thank you so much.